PAI-1 is what we call it. And I had never heard of PAI-1. In fact, most hematologists don't even check for PAI-1 when somebody has a hypercoagulability because it's so rare. Guess what? It is not at all rare. Not at all. So PAI-1 is on the fibrinolysis side, not on the clotting side. And as a result, I think it functions and presents a little bit differently. So when you're talking about factor V Leiden and talking about the genetics on the clotting side, the family history and the risk tends to be more venous clots, like PE, DVT, and that's what we talk about mostly and worry about in medicine. But on the fibrinolysis side, that PAI-1, the defect is not making more clots. It's a difficulty breaking down clots. So when people have PAI-1 gene variant, they're not as good at breaking down the clots, which means that the clots hang out for longer, and that can be problematic. And what I'm seeing, although I still have to do a little bit more research because there's not a lot of research on this, what I'm seeing is that it's those who have a family history of cardiovascular disease or cerebrovascular disease. And I have that on both sides, both mom and dad. I've started testing virtually everyone who I suspect has a biofilm or I suspect has a reason, and I have a chronic illness practice. And so most of the people who are coming to me, I'm worried. I'm not worried. I'm anticipating that they might have a clotting disorder. And so I'm checking everyone. I was originally taught to check PAI-1 activity. And if PAI-1 activity was high, then that was a reflex to check the PAI-1 genes. There are two genes. One is 4G and one is 5G. The 5G is normal. The 4G is abnormal. And as you know, you get one from each parent. And I have to tell you, the people who have PAI-1 genes, I'd say about 85-90% of my patients whom I've checked have PAI-1 genes.